Hello and welcome to Elderly and Wise. I'm Dr. Jane, and if you're new here, this channel is dedicated to helping you live a healthier, stronger, and more independent life after 60. Every week, we explore practical solutions for real-life health challenges, backed by science, guided by experience, and always focused on your well-being. Today, we're tackling one of the most frustrating and painful issues facing older adults, sciatica. That sharp, radiating pain that shoots from your lower back through your hips and down one leg can turn even the simplest activities into a daily struggle. And for many people, it seems like no treatment really works, or at least not for long. But what if 2025 brought something new? In this video, we're diving into the latest advances in sciatica treatment, technologies and techniques that are changing lives this year. Whether you're considering your first treatment or you've tried everything and still feel stuck, don't lose hope. We'll explore what's new, what actually works, and how you can find real relief without resorting to surgery or endless painkillers. So if you're ready to feel stronger, more mobile, and more in control of your life again, stay with me. Some of what we're about to uncover might just change the way you think about sciatica pain forever. What is sciatica and why it's so hard to treat? Before we dive into the exciting new treatments of 2025, let's quickly revisit what sciatica actually is and why it can be so difficult to manage, especially as we age. Sciatica isn't a condition on its own. It's a symptom, a sign that something is irritating or compressing the sciatic nerve, the longest and thickest nerve in the human body. This nerve starts in your lower back, runs through your hips and buttocks, and continues down each leg. When it's pinched or inflamed, the pain can be sharp, burning, or feel like an electric shock traveling down your leg. The most common causes of sciatica include a herniated disc, spinal stenosis, narrowing of the spinal canal, or degenerative disc disease, all of which become more likely with age. But here's the tricky part. Sciatica can also come from things that seem unrelated, like tight muscles, poor posture, or even years of sitting in the wrong kind of chair. That's why treating sciatica isn't always as straightforward as taking a pill or doing a few stretches. For one person, the pain may be triggered by nerve compression in the spine. For another, it may be inflamed by muscle tension or poor alignment. And for many, it's a combination of several factors. This complexity is exactly why so many people struggle to find long-lasting relief. They try medication or a few sessions of physical therapy, and when that doesn't work, they feel discouraged or assume surgery is the only answer. But here's the good news. 2025 brings us a whole new generation of sciatica treatments, options that are not only more targeted, but also less invasive and more accessible than ever before. And in the next section, we'll explore the most exciting innovations that could help you finally get your life back. What's new in sciatica treatment in 2025? If you've been living with sciatica pain, you know the routine: painkillers, physical therapy, maybe a cortisone shot. Then you cross your fingers and hope for the best. But the truth is, many of those treatments haven't changed much in decades. That's why 2025 is such a breakthrough year. This year, we're finally seeing innovations that are changing how we approach sciatica, not just managing symptoms, but targeting the root causes with greater precision and fewer risks. Let's start with one of the biggest game changers: non-invasive neuromodulation devices. These small, wearable tools use gentle electrical signals to calm overactive nerves. Think of it as retraining your nervous system to stop firing pain signals when it doesn't need to. In the past, nerve stimulation required surgery or bulky hospital equipment. But in 2025, compact, user-friendly versions are being made available for home use, and many are already being used successfully by older adults. Next, there's AI-guided physical therapy, another 2025 breakthrough. These are digital programs, some delivered through apps or smart TVs, that actually learn from your movements. They guide you through personalized exercises while adjusting in real time based on your progress. It's like having a physical therapist in your living room, helping you correct your form and avoid injury without needing to drive to a clinic. We're also seeing exciting developments in biologic injections. Unlike cortisone, which simply reduces inflammation, These new injections use proteins and regenerative compounds to actually heal damaged tissue around the sciatic nerve. Some studies suggest this could be a safer long-term option than steroids, especially for people over 60 who want to avoid the side effects of repeated injections. And for those who've tried everything and are considering surgery, there's now minimally invasive laser decompression, a highly targeted procedure that uses heat from a laser to shrink a bulging disc and relieve pressure on the nerve. The recovery time is shorter, the scar is tiny, and many patients are up and walking the same day. Even smart cushions and posture-correcting devices have gone high-tech in 2025. Some now use pressure sensors and gentle vibrations to remind you to shift positions or correct your spinal alignment throughout the day, helping to prevent flare-ups before they start. The bottom line? This year is about personalization, precision, and non-invasive options. Whether you want to avoid surgery, reduce medication, or finally find lasting relief, 2025 has brought new tools to the table, and we're only getting started. What actually works according to science and seniors? It's easy to get excited about futuristic treatments, but when it comes to long-term relief from sciatica, sometimes the most powerful tools are already in our hands. Over the past decade, researchers have tested a wide range of treatments, and in 2025, we have a clearer picture than ever of what actually works. The best part? Many of these proven strategies are accessible, safe, and especially effective for seniors. Let's start with the foundation: targeted exercise therapy. It's not about pushing through pain or doing generic workouts. Science now supports very specific movements, especially those that strengthen your core and support spinal alignment. Exercises like pelvic tilts, gentle stretches for the piriformis muscle, and low-impact aerobic activity like walking or swimming help reduce pressure on the sciatic nerve and improve circulation. A 2024 meta-analysis confirmed that seniors who practice guided, sciatica-specific routines 3 times a week reported up to 60% less pain in just 6 weeks. Next, let's talk about manual therapy, including massage, spinal mobilization, and chiropractic adjustments. For years, these were considered alternative, but today they're firmly in the mainstream. Especially for older adults with muscle tension or joint stiffness, hands-on therapies can relieve compression and improve mobility. Look for therapists trained in sciatica-specific protocols. Some practitioners now even combine manual techniques with vibration therapy or heat packs for enhanced relief. Another powerful tool? Anti-inflammatory nutrition. What we eat can either fuel inflammation or fight it. A growing body of research shows that diets rich in omega-3 fatty acids, leafy greens, turmeric, and low glycemic foods can significantly reduce nerve pain. In 2025, more doctors are integrating nutritional counseling into sciatica treatment plans. Seniors who adopt an anti-inflammatory eating style often report less pain, fewer flare-ups, and even improved mood and energy levels. And we can't forget mind-body interventions. Pain isn't just physical, it's also processed in the brain. New evidence supports techniques like guided meditation, cognitive behavioral therapy, CBT, and pain reprocessing therapy for managing chronic sciatica. These approaches help retrain the nervous system's response to pain, reducing the emotional and mental burden of living with it. For many seniors, this combination of physical and mental tools makes the biggest difference of all. It's important to note that the most successful outcomes usually come from combining these methods. A personalized mix of movement, hands-on care, nutrition, and mental resilience often provides the kind of lasting relief that no single treatment can deliver on its own. Myths and mistakes in sciatica treatment. When it comes to treating sciatica, misinformation is everywhere, and unfortunately, many people, especially older adults, waste precious time and energy on strategies that either don't work or make the problem worse. In this section, let's bust some of the biggest myths and reveal the common mistakes that may be sabotaging your recovery. Myth number 1. Bed rest is the best remedy. This is one of the most damaging beliefs. While rest may seem like the obvious response to pain, lying down for too long can actually stiffen the joints, weaken your core, and increase nerve pressure. In fact, Multiple studies have shown that gentle movement, like walking or stretching, can provide faster and longer-lasting relief than extended rest. In 2025, experts recommend staying as mobile as possible, safely and with support, of course. Myth number 2. Pain pills will fix the problem. Many seniors are prescribed muscle relaxants, NSAIDs, or even opioids to cope with sciatica. While medication can reduce pain temporarily, it doesn't address the root cause. Worse, over-reliance on pills can lead to side effects like dizziness, constipation, or dependency, especially in older adults. In today's best practice guidelines, medication is viewed as a short-term aid, not a long-term solution. Myth number 3. Surgery is your only real option. While there are cases where surgery is necessary, such as severe nerve compression or loss of bladder control, most people with sciatica do not need surgery. In fact, many modern procedures carry risks, and the outcomes are not always guaranteed. Before going under the knife, it's essential to explore non-invasive options first. In 2025, we have more effective alternatives than ever before, from biologic injections to advanced physical therapy. Mistake number 1. Trying to push through the pain. Pain is a warning signal, not a challenge to overcome by sheer willpower. Some seniors try to ignore their symptoms, continuing with painful movements or strenuous chores, thinking they're staying strong, but this can worsen inflammation or aggravate the nerve. Knowing when to rest, modify activities, or seek help is a sign of wisdom, not weakness. Mistake number 2. Using outdated equipment or poor posture at home. Many flare-ups are caused by how we sit, sleep, or lift objects. That old recliner might feel comfortable, but if it lacks lumbar support, it could be the reason your pain returns every evening. In 2025, ergonomic chairs, supportive mattresses, and even posture-correcting wearables are more accessible than ever, and they're worth the investment. Mistake number 3. Skipping follow-up care. Relief from one session of therapy doesn't mean the problem is gone. Sciatica often improves in stages, and stopping treatment too soon can lead to relapse. Whether it's physical therapy, chiropractic care, or lifestyle changes, consistency is key. Think of it as a wellness journey, not a quick fix. By recognizing these myths and avoiding these common mistakes, you're already one step closer to lasting relief. Real stories. What worked for people over 60? Sometimes, the most powerful lessons come from people who've been in your shoes. Research and expert advice are valuable, but there's something uniquely reassuring about hearing how someone your age overcame the same struggle. Let's take a moment to hear the voices of real seniors, just like you, who found relief from sciatica through a combination of persistence, knowledge, and the right approach. Meet Gloria, age 72, a retired schoolteacher from Arizona. Gloria had been suffering from sciatica for over 3 years. She tried everything from over-the-counter medications to hot compresses and even a cortisone shot. Nothing brought more than temporary relief. Then, in early 2025, her doctor recommended a new AI-guided physical therapy app designed specifically for older adults. With just 20 minutes a day of guided exercises and posture training, Gloria began to see results within 2 weeks. Today, she says she's 80% pain-free, and for the first time in years, she can sleep through the night without waking up in agony. Then, there's James, a 68-year-old former truck driver from Ohio. Years of long-distance driving had taken a toll on his lower back. His sciatica left him with numbness down his right leg and limited his ability to walk more than a block. James was skeptical of therapy, but after trying a wearable neuromodulation device his daughter purchased for him, he noticed a dramatic decrease in nerve pain. Combined with an anti-inflammatory diet and regular use of an ergonomic seat cushion, James is now walking 2 miles a day and even started gardening again. And finally, Teresa, 75, from Florida. Teresa didn't want surgery, but her pain was affecting her mood and social life. She worked with a chiropractor who specialized in seniors and incorporated gentle spinal decompression therapy with regular massage. In addition, she joined a local group that offered guided meditation for chronic pain. The emotional support and stress relief helped more than she expected. Today, Teresa says her sciatica is no longer the loudest voice in the room, and that, she says, is the real win. These aren't miracle stories. They're examples of what's possible when you take the time to find what works for your body, listen to your pain signals, and combine new tools with consistent care. Relief may not come overnight, but with the right guidance, it's absolutely within reach. Expert tips for managing sciatica in daily life. Even with the latest tools and treatments, daily habits play a massive role in managing sciatica. What you do every day, from the moment you wake up to how you sit, move, and sleep, can either help you heal or keep you in the pain. So let's talk about what the experts are recommending in 2025 for seniors who want to stay active, independent, and pain-free. 1. Start the day with a sciatica-friendly morning routine. Your first movements in the morning set the tone for the rest of the day. Avoid jerking out of bed or bending forward too quickly. Instead, roll to your side, gently push yourself up, and start with light stretches to wake up your spine and hamstrings. A few slow pelvic tilts, knee-to-chest holds, or seated cat-cow stretches can loosen tight areas before they become inflamed. 2. Choose the right chair and use it the right way. Posture plays a major role in relieving or aggravating sciatica. In 2025, ergonomic design is everywhere, but not all chairs are created equal. Look for seats with lumbar support, a firm cushion, and armrests. Your knees should be at hip level or slightly below, and don't sit for too long. Experts recommend getting up every 30 to 45 minutes, even if it's just to walk around the room or stretch. 3. Supportive footwear isn't just for walking. Whether you're inside or outside, what's under your feet matters. Wearing shoes with poor arch support or uneven soles can tilt your spine out of alignment and put pressure on the sciatic nerve. Look for orthopedic or memory foam shoes and avoid high heels or completely flat sandals. Some seniors even wear supportive slippers indoors for better posture throughout the day. 4. Embrace smart tech for movement reminders. One of the most exciting trends in 2025 is the rise of smart health devices for seniors. Wearable trackers and even pressure-sensitive cushions now remind you when it's time to shift your position or get up and move. Some even suggest light stretches based on your sitting pattern. These small nudges throughout the day can prevent stiffness and reduce the risk of flare-ups. 5. Wind down with a sciatica-conscious evening routine. Nighttime is when many people feel the worst pain. Why? Muscles tighten, the spine compresses, and sleeping positions often go unchecked. Try sleeping on your side with a pillow between your knees to reduce spinal rotation, or on your back with a small pillow under your knees to maintain natural curvature. Warm baths, low lighting, and relaxing stretches can also help your body and your nerves prepare for healing rest. 6. Keep inflammation in check every single day. From the foods you eat to the stress you carry, inflammation can quietly worsen your sciatica. Incorporating turmeric tea, omega-3s, or magnesium-rich foods like spinach and avocados can help. So can staying hydrated and getting quality sleep. And don't underestimate the power of stress reduction. Mindfulness, prayer, journaling, or even time in nature can calm your nervous system and ease your pain. Remember, sciatica management isn't about doing one big thing perfectly. It's about doing many small things consistently. These expert tips, when made part of your daily life, can dramatically increase your comfort and mobility without relying on pills or drastic measures. When to see a specialist and which kind? It's empowering to take charge of your sciatica with daily habits and natural remedies, but sometimes your body needs more than just home care. One of the biggest mistakes people over 60 make is waiting too long to seek professional help, hoping the pain will simply go away on its own. But sciatica is a nerve issue, and when it's left unchecked, it can lead to permanent damage. So how do you know when it's time to see a specialist? Start by listening to your pain pattern. If the pain hasn't improved in more than 6 weeks, or if it's actually getting worse, it's time to consult a professional. Also, pay attention to red flag symptoms, like numbness in the groin area weakness in your leg or foot, loss of bowel or bladder control, or severe, constant pain that doesn't improve with rest. These could indicate serious nerve compression and require urgent attention. Now, here's the part many people find confusing. Which specialist should you see? Let's break it down. Primary care physician, PCP. This is often your first stop. They can evaluate your symptoms, order imaging if necessary, and refer you to the appropriate specialist. Neurologist. If your sciatica involves significant nerve pain, numbness, or weakness, a neurologist can help assess the health of your sciatic nerve and rule out other neurological conditions. Orthopedic surgeon or spine specialist. These professionals are ideal if your pain is related to structural problems in the spine, like herniated discs, bone spurs, or spinal stenosis. They'll also guide you if surgery is needed, though in most cases, it's a last resort. Physical therapist. In 2025, PTs are more advanced than ever. They can create customized exercise programs that not only relieve pain, but also correct movement patterns, prevent recurrence, and strengthen support muscles. Some even use AI-guided tools for precision. Chiropractor. Many seniors with musculoskeletal alignment issues benefit from gentle chiropractic adjustments, especially when paired with stretching, massage, or decompression therapy. Make sure you find one experienced in treating older adults. Pain management specialist. If your pain is chronic and severe, pain management doctors can provide targeted relief through advanced therapies like radiofrequency ablation, nerve blocks, or regenerative injections. Their goal is to reduce dependency on medications and improve quality of life. Remember, no two cases of sciatica are exactly alike. That's why it's essential to work with a care team that understands you, your medical history, your lifestyle, and your goals for recovery. Don't be afraid to ask questions or seek second opinions. You are your own best advocate. Sciatica can be overwhelming. It robs you of comfort, mobility, and sometimes even your independence. But what we've seen in 2025 is incredibly encouraging, real progress, backed by science and designed to help people just like you. Whether it's wearable nerve devices, AI-guided physical therapy, or daily routines that ease inflammation and improve posture, the message is clear. You have more options than ever before, and better ones. You don't have to live in constant pain. You don't have to feel like surgery is your only answer, and you certainly don't have to go through this journey alone. If you've made it this far in the video, you're already taking steps to become more informed, more empowered, and more in control of your health. And that's exactly why I created this channel. Here at Elderly and Wise, we're building a community of older adults who are choosing strength over struggle, clarity over confusion, and wellness over worry. So what's next? First, if you found this video helpful, please hit that like button. It helps more people find this life-changing information. Second, subscribe to the channel and turn on notifications so you never miss an update on new treatments, senior health tips, or simple strategies to feel better every day. And third, tell me in the comments what has or hasn't worked for your sciatica. Your experience could be the encouragement someone else needs to keep going. Thank you for spending your time with me today. I'm Dr. Jane, and as always, I'm here to help you age boldly, move wisely, and live well. Until next time, stay strong, stay hopeful, and stay elderly and wise.